everybody. It's Amanda Martinez. I'm here with Physical Therapy Balance Center of Rockville, Maryland. I'm actually their marketing physician liaison. Today, I'm honored and blessed to have Dr. Linda Kuserk here with us today. So today we're going to be talking about diastasis rectus. So all the great things to know about different symptoms, treatments, prevention, and more. So Linda's going to give us some great information today, how physical therapy can actually help you. So she has asked me to ask some questions. So hopefully this will be very helpful for you all. And if you guys have any questions, please feel free to click on the chat little icon at the bottom of your screen and then type your question there. But we'll go ahead and get started. So hi, Linda, how are you?
I am fine, thank you. Thank you.
Welcome. So our first question today is, what is diastasis rectus?
All right. So diastasis rectus is a separation of the recti muscles that are in the front of the abdomen, and it's commonly seen during and following pregnancy. So I'm going to share a couple pictures so people can see kind of what the anatomy looks like and what happens. So first I'm just going to show, okay, so this is just looking at a person from the front, from the abdomen, and this is kind of a fascial sheath, and in the center is what is called your linea alba, and that is in the center between the two rectus muscles. And your rectus muscles are going from up at the top here down to the pubic bone. And so I'm going to stop that share. I'm going to show you the next one. Is, let me share more, okay. This is oops. Yeah, I think, okay. Can you see that one?
Yes, we can see.
Okay. All right, so this is showing the rectus muscle. That's kind of what is your six-pack abs, when people refer to that. And here it's showing a diastasis, where that linea alba has kind of stretched out. Okay, and I'm going to show you another one. No, I'm not. Okay, all right. I think that's all it's letting me share. Okay, so that's that. But that diastasis is that separation that is seen. And what happens is, as a woman is pregnant and that belly kind of expands and that baby expands, you get that separation to allow for some room. Okay.
All right. Thank you. Well, I have another question for you. So
Okay.
how common is diastasis rectus?
So nearly 2/3 of women develop a diastasis during pregnancy. So it's somewhat of a normal occurrence because you have to make room for that baby. What differs is the amount of that separation and how a person recovers from that separation and how their core is working.
Okay, cool. So I understand it's common for women, but is it also common for men as well to have it too?
It is more common in women, but it is also seen in men. I tend to see it in my older clients that have a large kind of beer belly or gut. You tend to notice it when people get on and off a treatment table, because as they get on and off, they tend to hold their breath, and you'll see this bulging in the center of the abdomen where that separation has occurred. So it is also seen in men.
Okay, that's good to know. So here we have another question for you. Are there things a person can do to minimize their risk?
There are. So I'm going to share another screen, another little picture. All right. So this is actually from Jenny Burrell's, like her website, but it's a wonderful illustration or GIF. When we think of the core in physical therapy, the core is made up of your diaphragm, and your diaphragm is a sheet-like muscle that attaches to your rib cage. It's kind of on the top, of your canister, the top of your core. Your abdominal muscles in the front, your back muscles, multifidi in the back, and your pelvic floor. And all the walls of my core work to, and I'm going to stop that share now. Well, actually, work to absorb the forces in the system. So I don't want my pressure any one way. And you can see here, as a person is breathing, as I breathe in, my diaphragm drops down, and as I exhale, my diaphragm goes up. My diaphragm drops down to allow my lungs to fill with air. you can see my pelvic floor in a perfect world is kind of working or reacting to that breath. So as I breathe in and my diaphragm drops down, my pelvic floor relaxes a little, and as I exhale, my pelvic floor raises up. So basically, when you think of that core, that canister, I want all those muscles working together to absorb the force so it doesn't go excessively one way or the other. So anything that tends to have me hold my breath will tend to increase the force below. So things that are help in the preventative way are, I don't want to be holding my breath and bearing down. So for women, you don't want to be holding your breath, and men actually, and bearing down for bowel movements. If I'm lifting something heavy, I don't want to be holding my breath and bearing down. When I'm getting out of bed, I don't want to hold my breath as I sit up. So you want to exhale with effort. So some of that pressure goes off and it's not all forced into that system. So a lot of times we'll say to patients to exhale as they're lifting the laundry basket, exhale as they're lifting another child, exhale as I'm, getting up out of bed, so that we're not bearing down into the system. So also for women that are pregnant, sometimes immediately postpartum, you can, what sometimes is helpful are ab wraps or recovery shorts. You don't want a heavy binder or something that doesn't have give, because it is something that's very compressive, or something without give is also going to put pressure down on that pelvic floor, and we don't want that. But some women find that a little bit of support to be helpful postpartum.
Makes total sense. Good to know. So as far as the abdominal binders, are abdominal binders helpful?
Yeah, I kind of went into that one again. Okay, so some support, like there are these postpartum ab wraps, and there's also like recovery shorts, but something that's very firm is probably not as helpful. So you want to have some give in that binder, so that, or in that support, not really a binder. A lot of times too, the recovery shorts, a lot of therapists will like that because you also have some support to your pelvic floor below, and it's not pushing everything down. The thought is if it's a binder that's not giving, then when pressure does go into the system, it's shooting down on my pelvic floor, and postpartum, that's already been stressed.
Makes sense. Good to know. Okay. So how do you know if you have diastasis? What are some symptoms somebody might have?
So concerns over diastasis is one of the big things that have postpartum women kind of find me because they know their stomach just doesn't look right, and that's one of the things they notice. So one of the things you would notice is that you would have this doming in the middle of your abdomen. It's almost like where that linea alba is, you see a little kind of mound. So when anything increases pressure in their system, they will see a doming through there, and that would definitely be a concern. So every time you go to get out of bed and you see this mound come up in the middle of your stomach, is one way you can see. The other way is to check those muscles. So there's a lot of things online, they'll say, oh, how to check for a diastasis, but basically what you're doing is you're feeling the rectus muscle belly. So a person is lying down with their knees bent, and they just lift their head up off the table or off the bed. So they're lying down, their knees are bent, they lift their head up. And if you see doming in your abdomen, that would definitely be something that you would want to have checked out. You can palpate, it's hard for me to see, okay. So here, you can palpate, so when the person's lying down, if you're palpating that rectus muscle belly, you can feel in the center, there's like a softness between the two muscle bellies, like if you can just feel where the muscle ends. And when that person lifts their head, you can palpate fingers between the muscle bellies. So if you feel a gap between those two muscle bellies, that's a sign that you have a diastasis.
Okay. You would say this is for both men and women? They would feel that?
Yeah, I mean, you would check it both ways in people,
okay.
But it's primarily we do that postpartum or during pregnancy. It's a little different during pregnancy because you have a baby there. But
little baby.
postpartum, yeah.
Perfect. So how much of a separation is actually normal then? Like, how would we know?
So traditionally, the thought was, oh, under 2 fingers isn't a concern, over 2 fingers is a concern. So that's like 2 fingers going this way, in that separation. The way therapists tend to look at it now is a little differently. We're looking at their function. Is their core functioning? Is that core stable? Do we see, so one of the concerns would be that doming. So you're doing activities and you have this continual doming. We have a large separation with a doming. We also look at, can the person create tension in those layers of the abdominal muscle below the rectus? So one of the big muscles that we look at is the transverse abdominis. So in my abdomen, let me go back here again. I have my rectus, which goes up and down, and then I have my obliques that go at an angle, and I have a lot of fascia, that kind of connective tissue that goes this way. And then way kind of over to the sides, I have my transversus. Those are the muscles in my abdomen and the most support to my core. So with a lot of back pain patients, you'll hear a lot about, oh, we're trying to, strengthen that transversus abdominis. But that transversus, it's almost like it's, if you said like to recruit it, it's almost like it's a corset or it's cinching a little bit. It gives you some support. So what we look for is, even with a person having a separation, if that transversus is coming in and giving them some stability and they're not doming through the middle, it's not as much as a concern as to a person that cannot recruit that transversus, or that is completely torn, and you get that instability, that doming. So it's really how they function with that separation as opposed to maybe how wide that separation is. And then there's, part of it is too, you want to make sure that a person has some support covering the organs in front. And if things are really separated and really torn and you can stick your whole hand in there, that's more of a concern than somebody that has some tension through the system.
Is recti treated?
So there's a lot of different programs out there on the internet. Initially, we thought doing rectus, recruitment exercises were terrible and would pull things apart. But some more recent studies coming in out now show that when the rectus contracts, it actually decreases the IRD, because if you look at like the insertions of the muscle, and if it's in slack and now I'm tightening that muscle, my like slack muscle will actually stiffen up a little bit. But how it's treated is we want to recruit those muscles and train those muscles without increasing that intra-abdominal pressure that might cause it to separate. So we look at how a person is transferring forces through that core, through that system. So we look at their pelvic floor, how that is coming in, how the abdominal muscles are coming in. So we don't want people doing exercises where they're holding their breath or bearing down. One of the things that many of the programs concentrate on is recruiting that transversus abdominis. That is the deepest layer of your abdominal muscles, almost like a little corset when you think of the kind of cinching to recruit those muscles. And they give some tension, to that core. So a lot of times we'll look at, can a person recruit that transversus? Is that gap, can I feel that transversus tense and support that area without bulging out through that area? Another way to look at it too is that transversus is that deepest layer. It's almost like the backboard that some of the other muscles can contract off of. So I want that deep layer functioning. So the treatment is very individualized. It's how a person is recruiting their muscles and how the pressure is going through the system. We're protecting the pelvic floor. We're protecting that separation with a gradual progression. And that is a very individualized thing.
That sounds great. So I have one last question.
Okay.
So how would one go about finding a physical therapist to actually help treat the diastasis rectus?
So to find a physical therapist in your area, there is the American Physical Therapy the American Physical Therapy Association, which is kind of the association, the professional association for physical therapists, has a section on pelvic health. So you go to the section on the APTA pelvic health section, and if you Google APTA pelvic health, it should come up. And in there, there's find a therapist. And if you click that directory and you put your address in or where you live, it'll list therapists in your area that have taken specialized courses in women's health and pelvic floor. So that would be a very easy way to find a therapist in your area.
Perfect. I know for those that are in the Rockville, Germantown area or willing to travel here to Rockville, Linda is a physical therapist here that can also help you with the pelvic and also the diastasis rectus. So she's a great resource that could also help you as well. So definitely call her if you need help. She's got a lot of great knowledge. Well, those are all the questions I have. Do you have any signing thoughts or messages that you want to share with anybody else on the call?
No, I think it's always good to see a physical therapist postpartum. In other countries, it's just the standard of care that women are evaluated by a physical therapist with their pelvic floor and their core to make sure everything is working, you know, appropriately, and to give them guidance on how to get back to the activities that they were doing pre-pregnancy. So I think it's, in a perfect world, everyone would see one, but definitely if you're thinking something's off with my core, my abdomen is bulging, I have this gaping distance between my recti, definitely see a physical therapist.
Awesome. Well, I don't see any questions in the chat box today, so I assume everybody was very well educated. So with that being said, we want to thank everyone for joining us today, and of course, reach out to Linda if you have any questions here at Physical Therapy Balance Center and Wellness Center of Rockville. So thanks, Linda, for all your time, and we appreciate all the education and knowledge you're able to share today.
All right. Thank you. Bye-bye.
Bye.